DCM is a pretty unique heart condition that stands for dilated cardiomyopathy, and even though it's a pretty crappy disease to have, I'm super excited to talk about it. Are you ready to science?
Oh yeah, I'm ready to science.
Then let's do this. With dilated cardiomyopathy, for one reason or another, the heart is not pumping out as much blood as it should. So in order to try and compensate for that, the heart is going to store more blood within the chambers in hopes that on the next beat, it can pump out more blood. As it builds up more and more blood, the chambers are going to get wider and wider or dilate from the inside out until it physically changes the size and structure of the heart. And that's when we see bad things happen. For a visual representation of that, I got me a spaghetti squash, and we're going to cut it down in a cross section, meaning we're going to look at it cut in half. So think of the two halves of my spaghetti squash as two different chambers of a heart. On my right, I have a normal heart chamber, and on my left, I have a DCM heart chamber. The inside portion is the actual chamber where all the blood sits, and then the outside portion are the muscles that actually make the heart contract. As you can see, they're both the exact same diameter, but with the DCM heart, there's a lot more space on the inside and a lot less muscle on the outside to actually do the job, and that's what leads to all those problems with this condition. DCM can either be primary, meaning the pet was predisposed to getting it, and there are some dog breeds that are predisposed to having this, or it can be secondary to some sort of environmental issue. The hard part about this condition is it often can't be diagnosed without an echocardiogram, and most pets pass away within a year once complications start to occur.